It was supposed to be a medical success story. A deadly disease, once rampant across continents, had been beaten back by science and public health collaboration. Measles, one of the most contagious viruses on Earth, had been declared eliminated in multiple regions. The vaccine was widely available, highly effective, and proven to save lives. Parents no longer feared the high fevers, rashes, or complications that once sent thousands of children to hospitals. But now, in 2025, that sense of victory has evaporated. Measles is back, and it's coming back fast. So how do we get here? Why is a disease we had under control suddenly surging across the globe? Why are children being hospitalized and, in some cases, dying from something that could have been entirely prevented? This isn't just a medical crisis. It's a reflection of society's crumbling trust, a digital age flooded with misinformation, and a global wake-up call that we can't ignore. As we dive into the unfolding story of the global measles resurgence, we'll examine the root causes of falling vaccination rates, the devastating impact on communities, and what can be done to stop the spread before it spirals even further out of control. This is not a distant issue. It's happening in cities, towns, and schools all around us. And the consequences could be catastrophic if we continue down this path. Let's begin with the facts. Measles is more than just a rash and a fever. It is a serious and potentially deadly illness caused by a virus that spreads through the air and lingers in spaces even after the infected person has left. Before vaccines, measles infected millions annually and killed over 2 million people every year globally, most of them children. It causes immune suppression, making the body vulnerable to other infections. It can lead to pneumonia, encephalitis, brain damage, and lifelong disabilities. But in the late 20th century, medical science gave us an incredible tool, the MMR vaccine, which protects against measles, mumps, and rubella. 2 doses of the MMR vaccine provide approximately 97% immunity to measles. Thanks to robust global vaccination programs, measles cases plummeted by over 90% by the early 2000s. Some countries achieved elimination status, meaning the disease was no longer endemic. It was seen as one of public health's most remarkable victories. However, with that success came a dangerous side effect: complacency. When the risk of disease becomes invisible, it becomes easy for people to question the need for protection. As the urgency of measles faded from public consciousness, skepticism began to grow. Social media platforms became breeding grounds for vaccine misinformation, and doubt spread faster than the truth. One of the most damaging myths can be traced back to a now discredited and fraudulent 1998 study that falsely linked the MMR vaccine to autism. The study was later retracted, and its author lost his medical license, but the damage was already done. Conspiracy theories took hold, amplified by social media algorithms that prioritized engagement over accuracy. Celebrities, influencers, and online echo chambers fueled vaccine fear, painting life-saving medicine as a threat rather than a solution. The COVID-19 pandemic only deepened this mistrust. While it brought unprecedented attention to public health, it also unleashed a tsunami of disinformation. Vaccines, mandates, and science itself became politicized. The ripple effect extended far beyond COVID. Routine childhood immunizations, like MMR, began to suffer. Across the globe, parents delayed or skipped vaccinations entirely. Some out of fear, others due to access issues exacerbated by lockdowns and strained health systems. The numbers paint a sobering picture. In 2023 alone, the World Health Organization reported over 300,000 measles deaths globally, a staggering 43% increase from a year before. Countries in Africa, Southeast Asia, Eastern Europe, and even pockets of North America and Western Europe are seeing major outbreaks. In the U.S., the Centers for Disease Control and Prevention reported that measles cases in the first quarter of 2025 have already surpassed total annual cases from previous years. In the UK, France, and Germany, schools are closing due to community-wide outbreaks. This isn't isolated. It's global. The resurgence is hitting the most vulnerable populations the hardest. Infants who are too young to receive the vaccine, immunocompromised individuals, and marginalized communities with limited healthcare access are at highest risk. Measles is an equal opportunity virus. It doesn't care about borders, race, or income, and it thrives wherever vaccine coverage drops below the critical threshold of 95%, the level needed for herd immunity. What's even more alarming is that this crisis is, at its core, preventable. We have the tools. We have the knowledge. We have the infrastructure. What we're lacking is collective will and unified action. When individuals opt out of vaccines, they're not just making a personal health choice, they're endangering others. Measles doesn't stay in one household. It spreads quickly and ruthlessly through communities. Some countries are beginning to respond more aggressively. In Australia, schools require proof of vaccination for enrollment. In Italy and Germany, parents can face fines for failing to vaccinate their children. In the United States, public health departments are ramping up education campaigns, offering mobile vaccination clinics, and in some areas, re-implementing mandates. But these efforts often meet resistance from well-organized anti-vaccine groups who exploit fear and confusion. So what can we do? First, we need to rebuild trust in science and medicine. That means consistent messaging from healthcare providers, government agencies, and educators. It means confronting misinformation head-on, not with mockery or dismissal, but with empathy, facts, and clarity. People are more likely to change their minds when they feel heard, not attacked. Second, we need to make vaccines more accessible. For some families, getting vaccinated isn't about belief, it's about logistics. They may live in remote areas, face language barriers, or lack transportation. Addressing these structural issues is crucial, or let disinformation steer us into another global crisis. Every parent, teacher, doctor, leader, and citizen has a role to play. This is not just about measles. It's about trust. It's about truth. It's about taking responsibility for one another in an increasingly connected world. Because when vaccination rates fall, the world becomes smaller, the risks grow larger, and preventable tragedies become the new normal. We still have time to change course. The solutions are within reach. But action must happen now, before the next outbreak hits closer to home, before more lives are needlessly lost, before we forget that we once had measles on the run. Thank you for watching. If you found this video informative, please like it, share it with your community, and subscribe to the channel. Help spread awareness, not the virus. Together, we can push back against the surge and move toward a healthier, more informed world.